All right, so let's bring in then into this conversation the political analyst, that's Lukhona Mnguni, to weigh in on some of what President Ramaphosa has said. Lukhona, thank you for your time. So I got a sense there that the president started out wanting to recapture that feeling of consensus building and also that goodwill, to rekindle that goodwill. So you saw, in my view, at the start there, a president who was going to, play open cards to say the situation will get worse before it gets better. Actually, the number of infections is about to get even worse. It's now up to you. Let's work together as we reopen the economy at level 3. But further down, the president making it clear that on some issues, they actually are drawing the line, particularly around the issues around the sale of alcohol, of tobacco products. So how successful was he in recapturing and rekindling that original goodwill that was there?
Well, I think, Tulas, some people will be happy with the president easing up the lockdown, allowing for about up to 8 million people to return to work and be productive and jumpstart parts of the economy that have not been as productive during level 5 and level 4 lockdown. Certainly, the issue of cigarettes is going to continue being a thorn, I think, on the flesh of government. And that's partly because I don't think enough time is spent by government in their messaging. The president did touch on it that, tobacco has some health effects that are negative on people who smoke, because this virus also attacks the lungs. It's a respiratory disease, and therefore you want to try and minimize the attack on people who smoke. But I think the messaging is still not coming out as adequately as it should and as thoroughly, in terms of saying, look, this is the evidence that we have and this is why we are moving with this evidence. Of course, it's one thing to ban the sale of cigarettes. It's another that there is an entire illicit market that has come up for the sale of alcohol, for the sale of cigarettes. And how is he making sure that they continue to suppress that illicit market? Because the issue is not that people are no longer smoking. Some people are still smoking. And what is the threat of that? In terms of the broad goodwill, though, I think much has been undone over the last 60 days or so of the lockdown, and it will take some time for that goodwill to come back, though some people will be happy to return to work.
Yeah. What about the other debate that was raging going into this, Lukhona, around the role of the advisors, the Ministerial Advisory Council, as well as other scientists weighing in on government's decision-making around, what measures to put in place as we move through the different levels of the lockdown? Do you believe that will have been quashed? I mean, I saw that the president made the point of acknowledging the MAC, Ministerial Advisory Council, but I wonder, though, if it will be enough to satisfy the criticism that says, actually, you're not listening to the scientists.
Well, look, Tulas, anybody can offer advice to government. At the end of the day, government must sit down, page through the different forms of advice they receive, and take a decision and have a standpoint. It is not for the MAC to always be listened to, but government must take us into its confidence about the type of advice that it is following. For example, the president spent some time on the issue of modeling and how the models are revealing the impact of the virus that is yet to come, and also how the modelers are showing how individuals should behave in order to mitigate and contain the seriousness of the surge of the virus. But there is something that is still missing, and you will realize that government has become less cautious to deal with numbers. Initially, the Minister of Health used to say 60 to 70% of the people will be infected with the virus anyway. But now you are not getting that. And there is a problem there, because if the president is saying they've had time to prepare the health system, and he gives us the number of beds, but we must be able to play those numbers against the projected surge when the peak in infection comes. And we are not able to do that, and therefore we are actually unable to evaluate whether government is telling the truth when they say that the health system has been prepared for the surge in infection. Because, Tulas, we also want to see how differentiated the preparedness is. It's one thing to count beds that are also in the Free State, beds in the Northern Cape, beds in the Northwest. When we know that our epicenter of the virus has become the Western Cape and to an extent the Eastern Cape, and therefore we want to see how that spread of resources is going to actually now start preparing for those particular areas, and including those that the president identified as hotspots. So we are none the wiser insofar as that is concerned.
Lastly, Lukhona, tell me your view of how well the president has done in countering the narrative that seeks to attach certain decisions of either on the earlier version, the National Coronavirus Command Council or the Cabinet to individual ministers. I mean, I can foresee a situation, for example, after tonight, where the Minister for Cooperative Governance, a department that's responsible for administering the Disaster Management Act in any case, but she's likely to come in under heavy criticism. How well has the president been able to counter that message and actually explain at length the way that cabinet works and how these decisions are arrived at?
He hasn't done enough of that beyond the letter to the public that he wrote about a week or two ago. And I think he should have, even in this address, spent some time on that to say, you can't demonize ministers for the positions they take. Effectively, they articulate the position of government. But politically, this narrative is pushed by people who do not wish to apportion any blame on the president, who do not wish to hold the president accountable for the mishappenings that are pronounced by the ministers. So then they deflect that back to the ministers. But when the government does good, somebody actually said this, that everyone wants to make sure that the president takes ownership of the good aspects of the government. And that is a bit of a dishonest public discourse to us, to divide and exonerate the president from being held accountable ultimately for all the decisions that his government is making. For example, Tulas, we are talking, yes, schools are going to reopen, but the economy is reopening. And the parents who are at home and have younger children who are in early childhood development and who are in primary schools, how do they return home when these children are not being sent back to school? Why do we start with older pupils when we are reopening schools and not the younger ones, so that there is seamless flow? As you reopen the economy, you are also able to remove the burden of care from the parents. So there are things that I think need to be questioned in the strategy that government is implementing going forward.
All right, Lukhona, thank you for your views and your insights this evening. That's political analyst Lukhona Mnguni there.